Unit 15 Neuro questions 5 90. A client is admitted to the hospital with a diagnosis of Guillain-Barré syndrome. The nurse inquires during the nursing admission interview whether the client has a history of 1. Back injury or trauma to the spinal cord. 2. Seizures or trauma to the brain. 3. Respiratory or gastrointestinal infection during the previous month. 4. Meningitis during the last 5 years. The correct answer is 3. Respiratory or gastrointestinal infection during the previous month. 91. A client is admitted with a neurological problem indicates to the nurse that magnetic resonance imaging may be done. The nurse interprets that the client may be ineligible for this diagnostic procedure based on the client history of 1. Hypertension, 2. Chronic obstructive pulmonary disorder, 3. Heart failure, 4. Prosthetic valve replacement. The correct answer is 4. Prosthetic valve replacement. 92. A nurse caring for a client with a head injury monitoring the client for signs of increased intracranial pressure. The nurse reviews the record and notes that the cerebrospinal fluid pressure is a varying mmHg. The nurse analyzes these results as which of the following? 1. Increase, 2. Borderline, 3. Compensating, 4. Normal. The correct answer is 4. Normal. 93. A client with Guillain-Barré syndrome has ascending paralysis and is incubated and receiving mechanical ventilation. Which of the following strategy would the nurse interprets in the plan of care help the client cope with this illness? 1. Giving client full control over care decision and restricting visiting. 2. Providing information, giving positive feedback and using distraction. 3. Providing IV sedative, reducing distraction and limiting visitors. 4. Providing positive feedback and encouraging active range of motion. The correct answer is 2. Providing information, giving positive feedback and using distraction. 94. A client just undergone computerized tomography, scanning with a contrast medium. The nurse would evaluate that the client understands post-procedure care if the client stated that he or she needed to 1. Eat lightly for the remainder of the day. 2. Rest quietly for the remainder of the day. 3. Hold medication for at least 4 hours. 4. Force fluid for the day. The correct answer is 4. Force fluid for the day. 5. A nurse is evaluating respiratory outcomes for a client with Guillain-Barré syndrome. The nurse would evaluate that which of the following is the least optimal outcome for the client? 1. Adventitious breath sounds. 2. Spontaneous breathing. 3. Oxygen saturation 98%. 4. Vital capacity within normal range. The correct answer is 1. Adventitious breath sounds. 96. A nurse is assisting with caloric testing of the oculovestibular reflex of an unconscious client. Cold water is injected to the left artery canal. The client expedes horizontal toward the right. The nurse understands that this indicates the client has 1. A cerebral lesion. 2. A temporal lesion. 3. An intact brain stem. 4. Brain death. The correct answer is 3. An intact brain stem.